Hello, everyone. My name is Ebony Mail, and today I will be presenting flexibility and balance assessment using the American College of Sports Medicine's Fitness Assessment Manual. While cardiovascular fitness and muscular strength often receive most attention, flexibility and balance are equally important components of health-related fitness. Throughout this presentation, we will be discussing components of the matter, how they are assessed, and how the results are used to design safe and effective exercise programs. This is factors affecting flexibility. Flexibility is shaped by both modifiable and non-modifiable factors. Flexibility is defined as the ability of a joint or series of joints to move through an unrestricted, pain-free range of motion. Static flexibility describes movements at rest, where dynamic flexibility refers to the ability to move through a range of motion during activity. Flexibility depends on the muscles, tendons, ligaments, connective tissues, and joint structures. Also, some flexibility factors can be modified while others cannot. Genetics and joint structures establish natural limits, whereas physical activity and regular stretching can improve your flexibility. Aging and previous injuries such as arthritis and inactivity often decreases flexibility. The ACSM recommends warming up before assessment because warmer muscles are more extendable. The benefits of flexibility. So here are a couple benefits of flexibility. You have improved movement, better posture, functional independence, and athletic performance. Maintaining flexibility improves movement efficiency during everyday tasks and athletic performance. Individuals with adequate flexibility often express stiffness due to posture, and great ease completing daily activities. Flexibility also contributes to healthy aging by supporting independence. So here we have what is balance. So balance is the ability to maintain the body's center of gravity over its base of support. Static balance occurs while remaining still, and dynamic balance involves maintaining stability during the movement. Balance depends upon continuous communication between the nervous system and the musculoskeletal system. Three systems responsible for balance: your visual system, your vestibular system, and your somatosensory system. So these three sensory systems work together to maintain balance. The visual system provides environmental information, and the vestibular system detects head movement and orientation, while the somatosensory system supplies perceptive feedback from your muscles and your joints. The brain integrates these signals to produce a coordinated movement. Consequences of poor balance. So these are some consequences of poor balance. You have falls, fractures, loss of independence, reduced mobility, impaired balance. So poor balance increases the likelihood of falls, particularly among adults, older adults. Falls can result in fractures, hospitalization, fear of movement, and reduced independence. Because of these consequences, Balance assessment is an important component of preventative health and fitness evaluations. Preparing for assessment. Before any flexibility or balance assessment, the ACSM recommends screening participations for medical conditions, reviewing injury history, and performing a light aerobic warm-up. Standardized instructions improve reliability, while close supervision during balance testing protects the patient's safety, the participant's safety. These principles, they help provide the foundation of the assessment techniques discussed in the next section. Sit and reach test. So the sit and reach test is one of the most widely used field tests of flexibility because it is inexpensive, it's easy to administer, and it has acceptable reliability when procedures are followed. The participants sit with both legs extended and slowly reaches forward while avoiding bouncing. The test primarily reflects hamstring and lower back flexibility rather than total body flexibility. So results can be interpreted within that context. It emphasizes slow movement and consistent technique. Here's another flexibility assessment, Backsaver sit and reach. So the Backsaver sit and reach modifies the traditional test by assessing one leg at a time. This approach is more comfortable for individuals with lower back discomfort, while also identifying side-to-side differences that could influence the movement quality or injury risk. This is another flexibility test. This provides precise joint ankle measurements, correct placement over anatomical landmarks, and consistent positioning are essential for valid measurements. It is useful when monitoring rehabilitation progress following an injury or a surgery. The single leg stance test is a balance test. It is a static balance test. The participant stands on one leg while the examiner times the duration. It always prioritizes safety by standing close enough to prevent a fall without providing assistance. Here we have another balance assessment, time up and go test, TUG. The time up and go test measures functional mobility by combining standing, walking, turning, and sitting. It is widely used because it reflects the movements commonly performed during daily life and can help identify individuals at risk for falls. So it captures a sequence of movements that mirror real world demands, making it a powerful predictor of fall risk and functional independence. So the test, you stand up from the chair and start the timer. Then you walk for about 3 meters at normal pace. Then you turn around at the 3 meter mark, and then you return, walk, and sit, and then stop the timer. Here's another test, functional reach test. This is a balance assessment. The functional reach test evaluates how far an individual can safely reach while maintaining a fixed base of support. So shorter reach distances may indicate an impaired dynamic balance and increased fall risk, particularly among older adults. And here is the test setup. The participant stands beside a wall-mounted yardstick and extends one arm to shoulder height. The reach distance is recorded from the start to end position, and the results show that the greater the reach, the better your dynamic control, posture control. Here is another balance assessment, the Berg Balance Scale. The Berg Balance Scale is a comprehensive assessment commonly used in rehabilitation settings. It includes functional activities such as standing, reaching, turning, and transferring. Although it requires more time than field tests, it provides detailed information about balance performance. Choosing the right assessment. So no single assessment is appropriate for every client. Healthy young individuals may only require a simple field test, while older adults or individuals with neurological conditions can benefit from multiple complementary assessment tests. So it's all based on the participant, if they are going rehabilitating from an injury, or if they just need a simple field test assessment. So this is the first case study. It is a 72-year-old woman with previous fall history. She has limited hamstring flexibility and difficulty standing on one leg. So for this client, I would begin the tug test, the time up and go test. And then I would proceed with the functional reach test and the back saver sit and reach test. These are all good for assessing the injury of the woman. And we talked about these 3 different tests and how they work in this case. So some assessment concerns is the elevated fall risk due to age and fall history. So also the suspected reduced lower body flexibility. That's where the functional reach test comes in, and potential neuromuscular balance deficits. Transition to exercise prescription. So assessment data are only clinically meaningful when they are translated into action. The next section of this lecture bridges evaluation findings with individuals, evidence-based exercise program. Improving flexibility, the FIT principle. So after assessing flexibility, the next step is to prescribe an individualized stretching program according to the ACSM. So flexibility training should also follow the FIT principle. Frequencies should generally include at least 2 or 3 days per week, although daily stretching may provide benefited results. Static stretching is appropriate following exercise as part of a dedicated flexibility session, while dynamic stretching is recommended before activity to prepare muscles and joints for movements. The PNF stretching is highly effective but often requires a trained partner. Improving balance. Balance can be improved through regular practice that progressively challenge the body's sensory and neuromuscular systems. Exercise may include walking, single leg stance, unstable surface when appropriate.